Hello, my name is Sanis Gutierrez. I'm currently a PGY3 at the Internal Medicine Program, UTRG Vietnam Medical Center, and I would like to give a presentation about the increasing opioid overdose among Hispanic young population on the borders of the United States and Mexico, as it's imperative to work with first responders in the proper use of Narcan. There has been an increasing number of Hispanic teenagers overdosing in the south of Texas, as has been reported at the emergency department and by the CDC. Currently, the FDA has approved naloxone for opioid overdose, which has been used for decades. The steps outlined in these sections are recommended to reduce the number of deaths resulting from opioid overdoses. The information is obtained from the Prevention Resource Centers 11, which is a program of behavioral health solutions of South Texas funded by Texas Department of State Health Services. It's part of a large network of prevention programs that aim to reduce alcohol, tobacco, and other drug use among adolescents and adults in the state of Texas. PRC 11 covers 19 counties in the South Texas region, including the Rio Grande Valley and the areas around the cities of Alfurias, Laredo, and Corpus Christi. And here's a picture of the areas that is being covered by PRC 11. From the Prevention Resource Center 11 in 2019 data show that among the individuals admitted to hospitalization due to substance use disorder, the most was associated with marijuana, which show 1,109 cases, but followed very closely by heroin, which had 1,019 cases. And then the third most common drug was alcohol, with 981 cases. What is an opioid? The word opioid is used to describe a group of drugs that act in the same place in the body to relieve pain. The place where these drugs work is called the opioid receptor, or mu receptor. Opioid drugs can be sold legally as a prescription medication, or it can also be found illegally on the streets. Such an example can be heroin. In addition to helping to relieve pain, these drugs have side effects which include sleepiness. In an overdose, toxic effects occur when there's an inability to wake the person up or there's respiratory failure. Some examples of opioids include heroin, codeine, fentanyl, hydrocodone, hydromorphone, pyridine, morphine, oxycodone, oxymorphone, and tramadol. What is an opioid overdose? An overdose is common among persons who use illicit opioids such as heroin and among those who misuse medications prescribed for pain such as oxycodone, hydrocodone, or methadone. There's an incidence of opioid overdose which is rising nationwide. In 2016, more than 42,000 of the drug overdose deaths in the United States involved some type of opioid, including heroin. To address the problem, emergency medical personnel, healthcare professionals, people who use drugs, and other community members who may witness and respond to an overdose are being trained in the use of opioid antagonist medication naloxone, which can reverse the potential fatal respiratory depression caused by opioid overdose. What is naloxone? Naloxone is an antidote that removes the opioid drug from the site in the brain where the opioid needs to be attached in order to work. When naloxone wears off, the opioid drug drug can attach again. When the opioid drug is no longer attached, breathing will return to normal if the person has gone into respiratory failure, has not gone into respiratory failure. Breathing can return to normal before the person is fully awake. And if the person receiving naloxone is breathing again, that means the naloxone did its job. What are the steps that we need to follow when we're suspecting that there's an opioid overdose? Well, first, we evaluate for signs of opioid overdose. What are the signs that we have to look for? Well, this includes some if the patient is unconscious or there's inability to wake him up, there's slow or shallow breathing or breathing difficulty such as choking sounds or gurgling, snoring noise from a person who cannot be awake. Fingernails or lips that are turning blue or purple. An overdose suspected. When overdose is suspected, the first thing we need to do is stimulate the person. Call the person's name. If this doesn't work, then vigorously grind knuckles into the sternum or rub knuckles into the person's upper lip. Continue to monitor the person, including breathing and alertness, and try to keep the person awake and alert. And what is the next step? Well, while you're following step one, you should have somebody calling 911, or if there's nobody around you that could provide you emergency medical services or any other trained personnel, you will have to call 911 yourself. All you have to say is, someone is unresponsive and non-breathing, and make sure you give the specific address and or description of your location. After calling 911, just follow this dispatcher's instructions. The next step will be administering the naloxone. As previously mentioned, the FDA has approved naloxone for opioid overdose. Naloxone should be administered to anyone who presents with signs of opioid overdose or when opioid overdose is expected. Naloxone can be given intranasal spray, intramuscularly, subcutaneous, or by intravenous injection. If the person overdoses and does not respond within 2 to 3 minutes after administering a dose of naloxone, administer a second dose of naloxone. All naloxone products are effective in reversing opioid overdose, including fentanyl-involved opioid overdoses. Although overdoses involving potent or large quantity of opioids may require more doses of naloxone. How do we administer the naloxone? Well, first we place the person in a flat position on their back. If we cannot do this safely, then just make sure the head of the person is elevated and straight. Then we administer the dose of the naloxone. Next thing is, if possible, rescue breathing should be done until the patient begins to breathe again. Then if the person is still not breathing well after 3 minutes, then let's repeat another dose of naloxone. If the person starts to vomit, then turn them onto the side so the vomit does not choke them. Then if the person starts to wake or breathe, move away to put some space between you and the person. Stay with the person until the emergency medical service arrives. What types of naloxones do we have? There is their FCO auto-injector, which is a 2 milligram dose of naloxone injected into the outer tide. There is the naloxone nasal via atomizer, which is a 2 milligram dose sprayed into the nostrils, half in each nostril. And then we have the Narcan nasal spray, which is a 4 milligram dose spray into one nostril. The auto-injector, as previously mentioned, is injected into the outer tide to deliver the naloxone intramuscularly or subcutaneous. Once this device is turned on, the device will provide verbal instructions to the user describing how to deliver the medication, similarly to automated defibrillators. Naloxone auto-injector is packed in a carton containing 2 doses to allow for repeat dosing if needed. The nasal spray is packed in a carton containing 2 doses to allow for repeat dosing if needed. Product delivers a 2 mg dose of naloxone into the nasal cavity, and kit requires assembly. Narcan, this is the brand name of naloxone and is produced by Adapt Pharm Inc. The naloxone comes in a spray device designed to deliver a 4 mg dose into a single nostril and does not require assembly. The atomizer can never be washed and reused later. Reuse is a risk for disease transmission. The small pores will become clogged, resulting in too small of a dose being given. These devices can be used in both adults and children, but check state's law. All these devices can be carried in a purse, bag, or backpack, or stored in a drawer or cabinet. After the devices are used, hand the empty devices to EMS. EMS will use the empty devices to verify the dose given, and EMS will dispose of the used device safely. The duration and effect of naloxone depends on dose, route of administration, and overdose symptoms, and is shorter than the effect of some opioids. The goal of naloxone therapy should be to restore adequate spontaneous breathing, but not necessarily complete arousal. Comfort for the person being treated, as withdrawal triggered by naloxone can feel unpleasant. Some people may become agitated or confused, which may improve by providing reassurance and explaining what is happening. The safety profile of naloxone is remarkably high, especially when used in low doses and titrated to effect. When given to individuals who are not opioid intoxicated or opioid dependent, naloxone produces no clinical effects, even at high doses. Moreover, although rapid opioid withdrawal in opioid-tolerant individuals may be unpleasant, it is not life-threatening. Naloxone can be used in life-threatening opioid overdose circumstances in pregnant women. The law protects whoever calls for emergency help, but only if 911 is called. Get help and dial 911.